Learning Service Population Assessment Analysis by Liz Rectorick, Dina Hall, and Kelly McAvoy. The service learning activity took place at St. Vincent de Paul in Buffalo, New York, which is located in Erie County. Their mission is to fulfill two great commandments, love of God and love of neighbor. The society does this by seeking out God's needy and providing help in whatever way possible. Easing the suffering of fellow neighbors, providing food, meals, and quality goods to the needy, providing temporary jobs to individuals who are not employed but need an income. These individuals help with sorting and packaging the donations. The society also visits those in need to assist both spiritually and materialistically. They have food and clothing drives as well as collection bins throughout the city. They have a vehicle donation program, and they also collaborate with drug companies to help those who need prescription drugs but can't afford them. Annually, this organization serves about 157,350 underprivileged, sick, or homeless individuals in Buffalo, New York. The society is also concerned with the needs of the aged, lonely, handicapped, permanently sick, homebound, and persons in nursing homes and hospitals. Activities that we performed were preparing food, serving food, portioning out and providing bags of bread, sorting donations, packaging donations, and cleaning. The purpose of this learning activity was to volunteer in and learn about the basic needs of the vulnerable populations within our community. This opportunity allowed us to take what we learned in theory and practice it in our community. After volunteering our time and meeting individuals within this population, we performed an assessment, which allowed us to identify and measure social determinants among this community. Through data mining, we were able to connect the community's social determinants to the health disparities that exist within this population. We then developed nursing diagnoses and discussed possible interventions based on our assessment. By participating in this activity, we learned that the community's social determinants and disparities directly affect the population's health, and we played a small role in improving it. According to Anderson and McFarlane, 2015, this is consistent with Healthy People 2020's renewed commitment to reduce health disparities through a determinant of health approach. Using the census tract for City of Buffalo and New York State, a data mining analysis was completed. You see a graph that shows a few social determinants that can be linked to the population's health. First, you see the marital status of the City of Buffalo is 23.5% compared to New York State's 43.6%. Buffalo is much lower than New York State, indicating only one household income in some places. The educational attainment, high school graduate or higher, in the City of Buffalo was 82.7%. which is lower than New York State's 85.6%. The poverty status below poverty level in the City of Buffalo is 31.4%, which is significantly higher than New York State's 15.7%. You can see how the poverty status and unemployment in Buffalo affects the housing tenure in the city as well. There are fewer homes that are owned with either a loan or clear and free in Buffalo when compared to New York State. The median household income in dollars per year for Buffalo is only $31,918, which is drastically lower than New York State's $59,269. Data mining from the Erie County Department of Health Assessment 2017 to 2019 indicates these mortality rates for 5 leading causes of death in Erie County 2014. As you can see, the totals are per 100,000. The top leading causes of deaths in Erie County are cancer, heart disease, unintentional injury, chronic lower respiratory diseases, and diabetes. You can find a comparison graph between Erie County and New York State regarding the prevalence rates of sexually transmitted diseases per 100,000. According to New York State Department of Health 2014, gonorrhea and chlamydia rates are much higher in Erie County than New York State as a whole. I'd like to also mention, according to Maternal and Infant Health 2014, the infant mortality rates per 1,000 live births in Erie County was 8, which is high compared to New York State's infant mortality rates of 4.8 per 1,000 live births. Buffalo is an urban community with a physical environment that limits access to healthy recreational activities due to its lack of parks and green space in its immediate city center. Lopez and Hines, 2006, suggests that people who live close to parks are more likely to use them and to be physically active than those who live farther from them. According to Lopez and Hines, U.S. surveys, including the Behavioral Risk Factor Surveillance System and the National Health and Nutrition Examination Survey, reveal that inner-city residents are more overweight, less physically active, and less healthy overall than the general population. Moreover, they suffer higher rates of diseases associated with obesity, namely diabetes and cardiovascular disease. Not to mention, urban differences in physical activity were found among all adults with urban propensity for inactivity greatest among low-income people. This links Buffalo's urban environment, lack of green space, low median household incomes, and high poverty levels to 2 out of the top 5 leading causes of death in Erie County. New York State Department of Health 2016 reported 39.8 per 100,000 alcohol-related accidents and deaths in Erie County compared to 32.2 alcohol-related accidents and deaths in New York State. They also reported a confidence interval of 19.7 in regards to binge drinking. This suggests a relationship between stress from poverty and increased access to bars and pubs, leading to higher levels of alcohol misuse in Erie County. In fact, Jones and Sumwell, 2016, highlighted a very strong overlap between the most marginalized population and those defined as having alcohol problems. They also described a well-established relationship between alcohol and the development of a number of diseases and health problems, as well as the effects its consumption has on social and economic consequences both to the individual and society. They also link binge drinking to certain cancers, heart disease, and unintentional injury, which all 3 correlate to the top 5 leading causes of death in Erie County. Additionally, they linked alcohol misuse to risky sexual behavior. Dinkelman and Lamb linked poverty, low income, stress, and low education to risky sexual behavior. You can see clearly how Buffalo's social determinants of low education, poverty, and alcohol misuse can directly correlate to their high levels of STDs and unintended pregnancies. The New York State Department of Health 2016 reported by only 63.4% of mothers receive adequate prenatal care in Erie County, compared to 69% of mothers receive adequate prenatal care in New York State, which, along with poverty levels, can be linked to increased infant mortality rates in Erie County. Our interventions are increasing police surveillance, such as public drunkenness, maybe heightened in poorer communities, providing free contraception or condoms, programs to keep kids in school, increasing education regarding substance abuse and safe sex, increasing access to Planned Parenthood facilities in Buffalo, promoting community health screenings and campaigns to educate and promote public health awareness, and new design policies to improve the built environment of inner cities. The core function of this society is to advocate for, and through donations, provide basic human needs to vulnerable populations within their community. The level of prevention provided by the society is both secondary and tertiary. Secondary examples are vehicle donation program, because it increases accessibility to care and to their work. The pharmacy program is also a secondary example, because it helps individuals get medications that they need but cannot afford. This reduces the impact of disease they already have and aims to prevent long-term complication from not taking prescribed medication. Tertiary examples are providing food and clothing to the homeless and vulnerable populations, making house visits to decrease suffering, and providing temporary jobs to those who are unemployed but need an income. These examples aim to help people manage their long-term poverty, unemployment, and inequities in order to improve as much as possible their ability to function, their quality of life, and their life expectancy. In the future, we would like to see collaboration among the services with St. Vincent de Paul in order to increase primary prevention measures that currently lack. Considering they help about 157,350 vulnerable people, this is a great opportunity to provide education and screenings. I think that it would make a positive impact to have a community health nurse on their staff. Considering their religious affiliation, I doubt that they work with Planned Parenthood, so they could set a basket out with free condoms and educational pamphlets to help reduce high prevalence rates of STDs in the community. This society already does such a great job, but because we know that they touch so many lives of our most vulnerable population in the society, with just a little more effort, it could be so much more. We could focus not only on their basic rights, but also their health needs as well. That's what we hope the society improves in the future.